So today's lecture is based on ultrasound protocols, and we'll be talking about the previous, that is Doppler ultrasound also. So please pay attention, and if you have any doubts, then please let me know. Is the screen visible? Please
I can
respond.
see it. That is very small.
Small it is. Now?
Yeah, okay.
Okay.
Better.
So, yeah, tell me. Is it fine? Should I start?
Yeah.
Okay.
Can you zoom it again a bit?
Is it okay?
Yes, madam.
Okay. So today's lecture is on ultrasound imaging techniques and the protocols. Here we'll be learning about how to do the scan and what all will be there in that image. To understand all that, you after this lecture you will understand that. Okay.
Yes, madam.
First, we have to study about Doppler ultrasound. Okay, for the last class, this topic was left. So, what is a Doppler? A Doppler, it was discovered by Christian Johann Doppler in 1842, and for Doppler ultrasound, we use a Doppler shift method. So, in Doppler, what we do is we will find out the blood flow in the arteries and veins. So, if there is any flow in the artery, or is there any blockage in the artery, with Doppler ultrasound we can perform that. Okay, so it shows blocked or reduced flow in the blood. So before studying Doppler, we have to know a little bit of physics about it. So there is something called Doppler effect. That is, it is the change in the perceived frequency of the sound which is emitted by the moving source. You all have heard about the siren of the ambulance. Okay, see in the picture you can see the ambulance moving towards two person. One person is behind the ambulance and one is away from the ambulance, in front of the ambulance. So as the someone mute your mic, one of yours mic is on, just muted. Okay, so what happens is whenever an ambulance passes us, we hear the sound frequency of that ambulance, of that siren, decreasing whenever it passes, whenever it goes away from us, we will hear the reduced sound. Okay, but whenever it is coming closer to us, we hear the sound frequency very high of that siren. So on same principle, the we do Doppler ultrasound. Okay, so in the picture you can see above there is the sound wave, ultrasound wave, which has troughs and crests. Okay, but down picture as the sound beam is moving away, the length, that is the wavelength, increases. Okay, and the frequency decreases. Whereas as it is coming closer to that front person, the wavelength is short and the frequency is high. So the front person will hear a higher frequency, whereas the back person who has passed the ambulance has passed will hear a lower frequency. So where all Doppler ultrasound can be used? So it is used for heart valve defects, congenital heart diseases, then to see if there is any occlusion, stenosis, if there is deep vein thrombosis, that is blood clots in the veins, which causes which causes the blockage in the veins, then varicose veins and arteriovenous malformations. So these are all the indications for Doppler ultrasound. Okay, and why Doppler is used? It is used to see the presence or absence of flow, to know the direction of the flow, and to check the velocity of the blood flow. So applications of Doppler ultrasound are, if we want to see if there is a presence or absence of flow, we will do a Doppler ultrasound. Even we can measure the velocity of that flow. So this Doppler effect is based on the Doppler equation which is there, wherein the ultrasound will detect the Doppler frequency change and will give us the readings. So this is the equation which you have to remember, wherein Ft is the frequency which is transmitted to the transducer, and Fr is the received frequency which is subtracted from each other. Okay. Cos theta is the angle between the insonation is the perpendicular to the vessel, and the theta which is there, it is the angle between the direction of the flow and the direction of the ultrasound beam. So this is the Doppler equation. So here you can see as the Doppler so where it is used? It is used in the blood vessels. Okay, in our blood there are RBCs which are flowing. So whenever this ultrasound beam hits this RBCs, we will get a signal. So here what they do is, whenever the blood is flowing towards the transducer, we will get a positive Doppler shift. Okay, and whenever it is flowing away from the transducer, that is blood is flowing away from the transducer, we will get a negative Doppler shift. And when the transducer is directly perpendicular to that artery or vein, we will get no Doppler signal. So whenever you are doing a Doppler, always remember that you have to keep the transducer parallel or at an angle, but not at 90 degrees, because at 90 degrees you won't get any signal. Okay. So the importance of Doppler angle is, so this angle is the angle between the ultrasound beam and the direction of the flow. In the picture you can see there are different placements of the transducer shown in the picture. Okay, so first one, wherein it is the Doppler angle, it is the angle between the transducer and that vessel. Okay, where the direction of that blood flow is flowing in that vessel. So whenever we keep the ultrasound beam parallel to the blood flow, we will get a shift is higher, that we will get a higher signal. Okay. Above picture shows that is the amplitude, that is the signal which is shown. So whenever it is moving to the left side, wherever the angle is less, it will have a highest Doppler signal. But as it moves to 90 degrees, we don't have a signal. It is very less. But whenever it is moving opposite side, that is away from the transducer, blood is moving away from the transducer, the spectrum is shown as downside. That means it is in negative. Okay, just now what I have explained. So whenever the ultrasound beam is perpendicular to the blood flow, there won't be any Doppler shift. So Doppler angle close to 90 degrees does not give us any information about the blood flow. So there are different types of ultrasound Doppler. There is continuous wave Doppler, color flow Doppler, power Doppler, and spectral or pulsed wave Doppler. Okay, each one will be discussed now. First one is the continuous wave Doppler. So here you can see that there is an ultrasound transducer, and that is down is the blood vessel. Okay, so what happens in continuous wave? The name only tells us that it is continuously transmitting and receiving. So how is it doing that it has two elements. Okay, one element will continuously transmit the beam and the other element will continuously receive the beam. So that will that with that help we will get a continuous wave Doppler. So these two elements are set in at an angle so that both these beams will get overlapped. Okay, so in that picture you can see the green area, that is the area where we get the transmit and the receive signal. Okay, the cross area, the crossover region is known as the active or the sensitive area. And the Doppler shifted signals, how we will get a Doppler shift? It is detected by comparing this transmitted and the received signals. So remember that in continuous wave Doppler, as the name suggests, we will get continuously, we will get both the signals, that is transmitted as well as received. So now what are the advantages of this continuous wave Doppler? It has a very cheap and simple design, and it is very easy to search a vessel with this Doppler. So it can display the blood flow patterns. But the disadvantages of this, it cannot distinguish. If there are multiple vessels, then it won't be able to distinguish the signal is coming from which vessel. Okay, so there will be some confusion, and we cannot measure velocity with this, and we cannot get the depth. Next one we move on to is the spectral or pulsed wave Doppler. So pulse means in this we will get Doppler signals from different depths. So here in this pulsed wave, we will get information from the depth. As of from the continuous wave, we won't get any information from the depth. So pulsed wave is used to get information from different depths. Okay. So it allows the detection of moving interfaces and scatterers only from within a well-defined sample volume. So in this picture, you can see the beam is coming from that rectangle only. So we won't get information outside that. So in that area only, we will get the Doppler information, Doppler signal. So that is called the Doppler sample volume. So this Doppler sample volume can be positioned anywhere along the axis of the ultrasound beam. Okay, so if you want to get a signal from the above, then you have to place it above or lower. That is called pulse wave Doppler or spectral Doppler. Is it clear?
Yes.
So here we will get the signal from the depths. That is, it is done by, see in the picture you can see the first pulse is transmitted, and then we get a signal, and the returning pulse we get the when we transmit the second pulse, we will get the returning echo. So what happens is only one pulse is transmitted. Unless and at that pulse receives back, then only we will get the information. Otherwise, we won't. Unlike the continuous, where we transmit both receiver and transmitter is working continuously. Here, once a pulse is given, we have to wait till that pulse returns back. Okay. So what are the advantages of this? We get the flow at one side. We have a good temporal resolution and calculation of flow velocities. But the disadvantages is sampling technique, that is a small area is used and it takes time. Why it takes time? Because the only single pulse is sent and we have to wait till that next pulse is sent back, and it is also angle dependent. Okay, so if we change the angle of the transducer, we will get a different information. Next is duplex scanning. Duplex meaning two. Okay, so what in this did is they combine Doppler flow information with the B mode image. Okay, so we can see the structures of the blood vessels, and it also shows the blood. It also shows the flow of the blood in the vessels. So we can measure the speed of the blood and also the diameter of that blood vessel. So that with that help, we can get if there is how much amount of obstruction is present in the vessel. So duplex means two informations are joined together, that is Doppler flow information and also the B mode information. In the image, you can see the colored part is called the Doppler flow information, and the background image is the B mode image. So on that we have pasted Doppler flow image. Okay, Doppler flow information. Triplex imaging means we will scan with the real-time B mode image, color image, and combined with spectral Doppler. So we are joining three things together. So it is called triplex imaging. Here we get to see the assessment and evaluation of blood flow over a very small region, as the sample volume, that is the range gating, is very small. So the sample volume can be adjusted along the axis of the Doppler beam, and in that way we will get a triplex image. Next is color flow imaging. The Doppler color flow will provide us information about the direction of the flow, if the flow is moving towards the transducer or it is moving away from the transducer. And what is the characteristics of that flow? Is it a turbulent flow? Is it a slow moving blood or fast moving? Is there an obstruction? All this information can be taken from the color flow imaging. Okay, so the picture shows the spectrum. This is a spectrum. Okay, and wherein it indicates blue, it indicates that it is moving away from the transducer, and flow towards the transducer will show in red, but this can be altered. So this is a picture wherein you can see a color inside that image. Okay, so we are getting a color information also, and plus the B mode image. So what are the advantages of this? It will give us the overall view of the flow within a region and tells us about the flow direction, and will tell us if the flow is, what characteristics of the flow, that is it a turbulent flow, if there are any anomalies, and if there is any absence of flow or present or occluded vessel, if the vessel is blocked. Disadvantages of this are the flow information is limited to the mean velocity. Here the temporal resolution is less, and it is also angle dependent. Next is power Doppler. Okay, as you can see in the picture, there is only one color which is shown. See the scale, it has an orange scale with a reduced color. Okay, it is moving to white slightly. So power Doppler will, it is also called the energy Doppler and or the amplitude Doppler or Doppler angiography. Here we do not get the relative velocity or direction of flow as we get in the color flow imaging, but here we use only a single color, and that will tell us the strength of that signal. Okay, how much bright it is, it will show that the strength of that signal is bright, and it is used in conjunction with frame averaging, so that we increase the sensitivity to low flows and velocities. So where it is used is wherever there are very low flows, like in to see the ovarian arteries, or to see the renal arteries, then we use the power Doppler. So if there is even slow flow, it can be detected with the power Doppler. The other names of power Doppler are energy Doppler or amplitude Doppler or Doppler angiography. Okay. Remember that only single color is seen in power Doppler. So what are the advantages of this? Since it is sensitive to flow, and it can be used to detect low flows, and it provides a better edge detection. Okay. Disadvantage is it cannot detect the direction of the flow as we get in color flow imaging, and there is poor temporal, and it is extremely sensitive to motion. Even if there is slight motion, there will be calculations will be wrong. So this was all about Doppler. That is what are the types of Doppler you have to remember, and what is the use of each one, with the advantages and the disadvantages. Is it clear? Do you all have any doubts with this?
Oh.
No, madam.
So now, yeah, okay. So now we'll move on to ultrasound protocols. Okay. So in our first class, we had discussed about the ultrasound machine. There are different knobs on the machine, and how to use it, how to use the machine. Today I'll be explaining that. So ultrasound machine have different protocols. What are protocols? They are presets, pathways in the ultrasound machine that will guide the sonographer through the required study images. Okay, so they have been made by the manufacturers and fed into that ultrasound machine. Okay, so if you are doing an abdominal study, what you will do is just you will first you'll enter the details of the patient, and then you will select the protocol, that abdomen. So what will happen is, whenever we are selecting that protocol, all the parameters are already adjusted for abdomen. Okay, so abdomen will be using which probe? Can anyone tell me for abdomen?
The convex or the
Curvilinear.
curvilinear probe.
Correct. Correct. Why we are using convex? Because we have to scan deeper. Okay,
Yes,
so we'll
madam.
be using convex probe. So okay, so I'll start with switching on the machine. Okay, so first we have to, there is a button on that control panel only, that is shows switch on and off. So just we have to switch on the machine, and it will take some time to switch on. Once the machine is switched on, we have to enter the patient details. So there will be a knob on that console only saying patient, new patient. We have to click that, and we have to enter the details of the patient. What all details are to be fed is the patient's name, age, then ID of that hospital, ID of that patient, and the type of scan. All these details are to be entered. Okay, once that is over, we have to select the protocol. Protocol, what is a protocol? I've told that they are presets which are fed into the ultrasound machine by the manufacturers. So what is the use of this protocols is, it makes them makes the sonographer easier to select the protocol, and without wasting time. Okay, so once the protocol is set, we have to select the transducer also. There is an option on the touchscreen or on the monitor console to select the transducer. So we will be selecting for abdomen curvilinear transducer, and then we can start the scan. Okay, so why these protocols are important is, it will help sonographers to take command of the workflow by providing customizable exam guide. And these protocols offer greater exam consistency across all sonographers. Last class, I told you all about radiographers and sonographers, okay, and radiologists. So radiologist is a doctor, whereas sonographer is a person who does the sonography. It can be a technologist also, or a doctor, okay. If it is a doctor, then it is called a sonologist. Okay, so the protocols will reduce our time. If we select the correct protocol, we will get a good image quality without making much adjustments. But if we are doing an abdominal study and I have selected a thyroid protocol, then the image quality will decrease. Okay, so always remember to select the protocol properly based on the study. So these are the few images of ultrasound machine. Is it visible for everyone?
Yes, madam.
Okay. So you can see the images are in shades of gray and it is black. There is a scale on it here. Can you see the marker?
Yes, madam.
Yes.
So this is the scale which is called the gray scale. Okay. So you can see that the darker ones, this is the scan of the abdomen, pelvic region, wherein we can see the what is that amniotic fluid. Okay, and this is the fetus. This is a scan of the pregnant lady. This is the fetus. This is the uterine tissue which appears as gray. So tissue will appear gray, fluid will appear black. This is also tissue, so it appears gray. Okay. In the second picture, you can see some hyper areas, white areas. So these are not tissue. It is bone. Okay. So this is the fetus, wherein it is the cranium, that is the head part of that baby. Okay, so it appears bright. So in the second last picture, here you can see white spots. These are the rib cage of that fetus, wherein it appears white. Okay. See here, there is fluid which is appearing black, and rest all tissue is appearing gray. One more difference you can see in this picture. See the top part, the image. It has a curved area. Okay. Whereas in this image, here we have used a convex transducer, and here we have used a linear transducer. Why? Because it is rectangular area.
Rectangular.
Okay, so now we have to learn about the scanning planes, how we will position the transducer. Do you all know about the planes of the body? How many planes are there?
Corona, clay.
Which one?
Corona, sagittal, longitudinal, transverse.
Oh, okay. So here also we use scanning planes. Scanning planes are used to establish the direction that the ultrasound beam will enter the body and the anatomical portion of the anatomy being visualized from that particular direction. So mostly our probe will be kept in the longitudinal or the transverse positions. Okay, this two position. But since our organs are slightly located differently, some if we see our pancreas, it is located underneath. So we have to tilt the probe. Okay, so that will give us an oblique plane. Okay, that is slightly twisting or rotating the transducer. Longitudinal view shows the structures length and depth, whereas axial view will show us width and depth. Okay, remember this: longitudinal plane, axial views, longitudinal views and axial views, and the oblique view. In longitudinal we will get length and depth, and in axial we will get width and depth, also called the transverse plane. So once you get a chance to see a transducer, just hold the transducer and feel. Okay, so you will find a slight raised part on that transducer. Here you can see in the linear transducer a small dot. So this is the orientation marker. Okay, some of them will show as a dot, or some of them will have a raised portion. Why it is kept is that will tell us the direction, how the image will be presented on that console or the monitor. Okay, so this is called the orientation marker, and it is located on the side of the ultrasound transducer. If you don't find an orientation marker, how to identify which side is the right side and the left side is just by placing the you have to put the coupling agent, that is the gel, on that transducer and just place your finger. Okay, so what will happen whenever we place that orientation marker side, if you place our finger, it will show on that image that is on the left side. Okay, so this is the patient's right side. Wherever the marker is, this marker it will be shown as the company's name, whether it is G or a symbol of that company. Okay, so in this picture you can see a Z, so this will show the right side of that patient. So this marker, the transducer probe placement, should always be remembered with that marker. So ultrasound images have different echogenicities. We can't just say that it is white, dark, or black. Okay, There are specific terms to be used with this. So different structures will emit different signals on the ultrasound imaging, and these are called echogenicities. Okay, and first one is the hyperechoic structure. Hyperechoic means it will appear wide or and bright on the ultrasound image. See the first box, it shows hyperechoic. Okay, that is where all these structures, that is the bone, ligament, dura, and nerves will appear hyperechoic. So from now on, you'll have to use the word hyperechoic whenever you are telling us about is it white or bright. Okay, so bone will appear as hyperechoic. Whenever we get angry, we become hyper. So remember in that way, white means hyperechoic. Next is isoechoic. Iso means they have same density as the surrounding structures. So they will appear gray. Okay, that means they are isoechoic, such as muscles. And hypoechoic will appear dark, which will produce a very low signal. That's why they appear dark. What are the examples? Are all the fluids, that is CSF, blood, and intrathecal spaces. Okay, so remember the terms. Echogenicities in ultrasound, whatever signals we get are called echogenicities. They can be hyperechoic, hypoechoic, or isoechoic. So in ultrasound, we use the term echoic because it is sound echoes which are coming back. Okay. Now let us see some images and let us learn about identifying different structures. So first we'll go for blood vessels. So this is a scan of the thyroid part, okay, with a linear transducer. So there are two orientations which can be taken, either longitudinal or transverse. Okay. So first one, in this picture we see the veins and the arteries. So IJV, that is internal jugular vein, and the second one is the carotid artery. Can you all see this?
Yes, madam.
IVJ and carotid artery. Just beside that, this is the thyroid. Okay, a small part of thyroid can be seen. So if you place a transducer on your neck and try to see this, you will get this picture. So how you will get the circle is when you go in the transverse plane. Okay, then only it will appear as circular or hypoechoic structures surrounded by a hyperechoic rim. Okay. These arteries can be easily identified by their pulsatility. That is, arteries will pulsate more, whereas the veins will, whenever we apply pressure on the probe on that area or the veins, it will collapse. Okay, it will change shape. So in transverse, we will see as cut sections because transverse means axial scanning, right? So here we see the arteries and veins as round, okay, in this plane. So if I show you the picture, you should tell me that whether it is a transverse plane or a axial plane, or longitudinal plane. Okay. See, in the down picture, it is the arteries and the vein is longitudinal, so long axis is shown. Okay, and on this only we have to measure the Doppler signal. We can't measure Doppler on transverse. Is it clear?
Yes, madam.
Yes, madam.
So how nerves will appear? So these arteries will appear as hypoechoic inside, and the rim will show a little bit hyperechoic. Okay, so that will tell us that it is an artery or it is a vein because blood will appear hypo. Next, how to see the nerves? So these are the nerves below the clavicle and in the lower limbs. They are seen as hyperechoic and have a honeycomb appearance. So the degree of hyperechogenicity will reflect the connective tissue, presence of the connective tissue within this nerve. In longitudinal view, they will appear as hypoechoic longitudinal elements which are interspaced with hyperechoic perineural connective tissue. Okay. Here you can see the brachial
We can
plexus.
see, madam, but please come again.
Sorry.
Please come again. I didn't really get you well.
Okay, okay. So nerves, we have nerves in our body which sends us signals. Okay, and we do ultrasound for those also. So it is best seen with this ultrasound imaging and or with MRI nerves. So below this image is of the cervical part, and the appearance of the nerves will be hyperechoic. It will be little slightly brighter. In this also, this is the nerve which is seen, which is little bit hyper, not like the bone, but slightly hyper than the surrounding area. Okay, and the hyperechogenicity, that is how bright it will appear, will depend upon the connective tissue, that is the makeup of that nerve, how it is made. On that, it will be dependent. Next as the ligaments and bones, they will appear as hyperechoic on the ultrasound, that is bright. Since bone has a high acoustic impedance, that is the bone can absorb more ultrasound beam than the rest, so it will not allow the sound wave to pass through it. So what will happen is it will produce a shadow. Someone please unmute, sorry, mute yourself. Okay, so what is a shadow? In this picture you can see there is a hyperechoic structure and below that there is a black area. You can see.
Yes, madam.
Okay, so this black area tells us that there is a bone above this. This is the bone. Okay, so this is an indication that whenever we get an acoustic shadow, there is a bone. So whenever you have a like, if you have a doubt, because the calculus, that is the stones, will also show hyperechoic structure. Okay, they will also show acoustic shadowing because they are denser and they will not allow ultrasound wave to pass through it. So always remember, whenever you are scanning, whenever you are doing a scan, if you see a calculus, you will see the shadow. So you have to look for the acoustic shadow. That will confirm that whether it is a calculus or not.
Hello, yeah, Kavita ma'am, sorry for disturbance.
Yes, sir.
Ma'am, you can just kindly ask them to switch on their cameras because you're not
Oh,
able to see them. So we have to recognize, what exactly they are learning and what not. So they
okay.
can just all switch on their cameras, please, so that we're able to see that what is happening on the other side.
Yes, sir.
Yes, respected ma'am, and including your camera also kindly in case it is possible. Thank you so much, ma'am.
Switch on your cameras.
Thank you all. And Mayank, hello. Manka, please switch on your camera, please. Please switch on the camera kindly. Okay. Please kindly start, ma'am. Thank you.
Okay, so as I've already told, there are two planes for scanning. There is longitudinal plane and the transverse plane. So in longitudinal plane, which usually refers to scanning the plane parallel to that structure. So if we are keeping the probe parallel to that structure, it will be a longitudinal plane. Whereas in transverse plane, what we will do, we will keep the um, transducer, sorry, we will keep the transducer perpendicular to that structure. Okay, so whenever your probe is parallel, it will be longitudinal plane, and whenever your probe is transverse, it will be the perpendicular to that structure. So now whenever we have started the scanning, we have to do some slight adjustments even after selecting the protocol, which is set by the company. That is fine. Once we have adjusted the transducer with the to get a perfect image, we have to also do settings on that console. That is the depth setting and the gain setting. These are the two important settings which has to be done. Okay, and it can change on different doctors or the person who is scanning, because ultrasound is mainly dependent on the operator. If you are very if you know to do the scan perfectly, there won't be you will get an image very faster than the rest. Okay, so you have to do the depth setting, that is the depth, how much deep you have to want to scan. Or if you are scanning a superficial nerve block, the depth should be around 5 centimeters. But for other scanning, then you can increase it to 13 centimeters if you want to scan deeper organs. Usually for linear probes, we will keep it short. It will be 1 to 6 centimeters. So we have to keep it at 2 or 3 centimeters. Okay. But for abdominal scanning, we will keep it at 12 centimeters, because the depth can be adjusted till 30 centimeters. So to get a perfect image, we have to adjust the depth setting on that console panel. There will be an option knob of depth which can rotate it. And there is gain setting. Gain will tell us the brightness, how bright we want the image. Okay, so we have to adjust slightly the gain so that we can allow the, if you want to reduce the signal, then we will reduce the gain, and if you want to enhance the signal, then we will increase the gain. That will make the image brighter or darker based on the gain setting. So remember that after the protocol is set and after you start doing the scan, you have to adjust these two parameters, that is depth and the gain. Okay. And before starting the scan, you have to apply the coupling agent, that is a jelly which is applied for all the ultrasound scans. Without that, we cannot start the scan. Why it is used is because sound, as I've already told, it requires a medium to travel. So whenever we are placing the transducer directly on the body, there is no medium in it. Okay, there is air between them, so it cannot travel. So whenever we place that jelly, it helps the transducer to uh, move the transducer easily, and also the waves, that is sound waves, will be traveled faster through that jelly. Okay, so that is called the coupling agent. So there are different movements of the transducer. We can slide the transducer. We can tilt the transducer front and backwards. We can rotate the transducer from 90 to 0 degree, and we can rock the transducer to see different different organs. Okay, to get a better view of that organs. So I've told you about the I've told you about the marker on that probe. Okay, so that will tell us the orientation of the image. So in longitudinal orientation, we have to keep the probe so that the probe is pointing towards the patient's head. Okay, so longitudinal means we have to keep it. How we have to keep it in longitudinal plane?
Towards the patient's head.
Yeah, it should be parallel or it should be perpendicular.
Parallel.
So what we do is, using the longitudinal orientation, we hold the probe so that the orientation notch is pointing towards the patient's head. So what happens is, the right side of that cranial side of that patient, that is head part, will be shown on the left side of the image. Okay. Always remember, whenever you are using longitudinal, the direction of the probe will, the marker will be on the head side, and the image will be shown on the left side. That is, the head part of that image will be shown on the left side. And whenever, if you rotate the probe to transverse, the notch will be directed towards the patient's right side. So we'll get the image on the screen. Okay, that is, the patient's right side will be seen on that screen as the marker. If you if you keep the marker on the left side of the patient, the image will turn. So always remember to position that transducer properly. And if you have doubt, what you have to do is just put the gel on the transducer and place your thumb or a finger on the one part. If you can see that there is if you can see that the gel is compressing on the left side, that means you have to turn the transducer. So this was about all about the probe and how we have to do the scanning. Now we'll start with the abdominal scanning protocol. Okay, how to do the abdominal scan. So in abdominal scanning, what are the indications? Indications means that what we have to, why we are doing that scan. Okay, whenever a patient has any abdominal pain, we will go for abdominal scanning. Or if there is an abscess is infection. Okay, intra-abdominal abscess, also called pus, then we go for abdominal scanning. If there is a non-specific abdominal mass, if there is ascites, that is collection of fluid in the peritoneum, to see that, and if there is any abdominal trauma. So remember that indications means what is the cause of that study, why we are doing that. For abdominal scanning, usually we tell the patient to fast for 8 hours before the examination, and if we can tell the patient to drink water so that the bladder is full. But usually if we are doing only the abdomen, that is including the liver and pancreas and the small bowel, then we do not want the patient to drink water. There is no need. But if we are doing scanning the uterus or the ovaries, okay, then we tell the patient to drink water. So the patient position, the patient will lie down supine on the table in the ultrasound room, and we will cover the patient with the coupling agent, that is the jelly, and then we'll select the transducer and the protocol. So for adult, if it is there, then we use a 3.5 megahertz frequency, and if it is children, then we have to use 5 megahertz frequency. Okay, because children will require lesser frequency than adults. Before starting the scan, we have to first know the anatomy of that patient, okay, or the human anatomy. Where is the symphoid process and where the ribs will start. So we have to place the transducer at the point centrally at the symphoid process and tell the patient to take a deep breath and hold. You can see in this picture, the symphoid process is just, you can feel it on yourself also, just below the ribs. Once your sternum gets over, the central part just below that, there is a symphoid process. So you have to keep the transducer on the in that position, and then start the scanning. Tell the patient to hold the breath whenever we are doing the scan. Then angle the transducer to the right of the to see the lever, and then adjust the gain so that we get a homogeneous image. Okay, in this view, we will get the portal and the hepatic vein is visible in this view. They will be seen as a tubular structure with echo-free lumen. Okay, so in that same position, we have to move towards this side. and then scan down, scan this side also downwards, so that we can cover the whole abdomen. This picture it is shown. They are scanning starting from the symphoid process. They are moving towards the left side. So it will be in a row. So start moving so that you do not miss anything. So once you scan the liver, you have to move on to the spleen. Then you have to check the kidneys. Then you have to check for any fluid. Then the bladder. So once we do the transverse scan, we have to turn the transducer and start doing the longitudinal scan and start again from the symphoid process and then move downwards. Okay, so this is the image which shows the liver with their arteries and hepatic and portal veins. So we have to get the full liver and all the area should be covered. This is the it is scanning from top to down. This is what all measurements to be taken. That is, we have to measure the liver length and breadth. If it is enlarged, then we have to know that. Then if there is any gallstones in the gallbladder, then we have to see that. We usually tell the patient to fast because if the patient is not fasting, the gallbladder cannot be seen. Okay, gallbladder usually contracts once we eat food because it will secrete that bile for digestion. Sorry, is there any doubt?
No, madam.
So that's why we tell the patient to fast. Otherwise, the gallbladder visualization will be not there and we will miss some of the pathologies. If there are stones in the gallbladder, then we will miss that because the gallbladder is empty. Then we have to see the biliary tree that is inside the liver. So scanning of the liver, as I have told, from transverse to longitudinal, we have to scan. Then measure if there is CBD, common bile duct, we have to measure the diameter of that. Then we have to see the pancreas, if there is any mass in the pancreas or the pancreas has contracted, then note it down if it is there. Check the right kidney, left kidney values, that is length, breadth. Okay. Then the spleen, we have to see, measure the size of that spleen on the left side. Then the outcome, and if there is any pelvic pathology are there, then we have to just screen it. At the end, we will write the impression whether any issues are there in the patient. Okay. Otherwise, we just write that there is a normal study. So this is a example of a report. Different hospitals will be using different formats for report, but usually the measurements are this. Okay. So for Doppler also there will be a different measurement. If you are doing arteries and all, there are different measurements to be taken. So this was all about the abdominal scanning. Next, we move on to the obstetric scanning, that is scanning of the pregnant woman to see if the fetus is properly growing. Okay, so there are 3 trimesters. That is, first trimester is the gestational period, that is between the conception and 13 weeks plus 6 days. Okay, that is the first trimester. Second trimester measures from 18 to 32 weeks after the last menstrual period, and third trimester is 32 to 36 weeks. So you have to remember these trimesters and dates because during this time only we will be able to visualize the structures much proper and take the measurements. Okay. So ultrasound is preferred for pregnant ladies because it is safer than any other modality, and we can see the fetal health of the fetus with the ultrasound by different measurements. So what is required whenever we are doing an obstetric ultrasound is we have to know the last menstrual period of that female. Okay, that is once the period 7-day cycle gets over, from that day to the day of this. From that day, we have to calculate the growth of that baby. Okay, so that date is very important. That is the last LMP. So we have to enter whenever we are doing an OB scan, also called the obstetric scan. We have to enter the last menstrual period. Okay, so that we know the gestational age of that based on the machine. That will tell us when will the female when will the baby will be delivered. So that one is the normal with the LMP method. We can calculate that after 9 months it will show the exact date, and with the measurements which are taken on the ultrasound machine, on that basis also we can get the delivery date. Okay, expected delivery date. So it is very important to mention this LMP. Here we have to mention the patient details, age age, the name of the patient and ID, and the LMP. Okay, so the pregnant ladies can come during this 3. They are usually advised to come. That is during the first trimester, one scan, then in the second trimester and third trimester. In third trimester, usually if there is any anomalies, then they will be called frequently. Okay, but in the second trimester, it is most important, wherein we calculate most of the measurements and we tell the whether the baby is growing properly or are there any abnormalities. So when we will do the first trimester scan, whenever the patient has vaginal bleeding or any pelvic pain, to estimate the gestational age and to see if there is any to see the routine assessment. Okay. So during the 18 to 22 week scan, it is performed to, these are the indications why we do the scans during this trimester. Okay. In second trimester, we will be checking the gestational age accuracy. Then if there is any multiple pregnancies are there because the baby has formed, and if there are any fetal anomalies, and to locate the placement of the placenta, if it is a placenta previa, if there are chances of placenta previa, then first only they will check. Okay, and to see if there is any myomas or any other. Last is the 32 to 36 week, that is the third trimester. Here we do the scanning to recognize any intrauterine growth retardations, to see if there is any fetal anomalies, to confirm the presentation and position of the fetus, and to check the amniotic fluid assessment, and to exclude any complication, that is myomas if there are there. So if it is affecting the baby, that they will check in the third trimester. Okay, during that scan. So whenever the patient comes for the first trimester scan, usually we can do either transvaginal scan or we can do transabdominal scan with the convex transducer. Okay. Why we go for transvaginal? Because the gestational sac is very small, and if we want to see it more clearly with more resolution, we will go for transvaginal scans. Otherwise, transabdominal is okay. And for this study, if we are doing a transabdominal scan, we require the female to woman to have a full bladder. Without full bladder, we cannot do the scan. Okay, so you have to tell the patient to drink a lot of water, that is 1 liter of water, and wait for some time till they feel that the bladder is full. Okay. And if you are doing a transvaginal scan, then we have to tell the patient to empty the bladder. We cannot do transvaginal with a full bladder. So the patient will be lying on the supine on the bed, and during a transvaginal same it will be supine, but here we tell them to flex their knees and hips. Okay, because we'll be inserting the transvaginal probe through the vagina. So these are some of the pictures of the obstetric scan. In this, in the first picture, this is transvaginal scan, wherein you can see the gestational sac, okay, and a fetus. So we measure if there is any that is cardiac activity in this during the first trimester, and how many gestational sacs are there. And this is a later scan of the head of the baby, wherein we will measure some of the crown rump length. These are some of the measurements of the head. Okay, head circumference, abdominal circumference will be taken. You can see this is the head part of the baby. This is a report, slight blurry, but you can see that there is a hospital name, the exam date, and the LMP mentioned in it. Then there is also how much till date, what is the weeks, how many weeks it has completed, it is shown. Then these are the measurements which has to be taken depending upon the trimester we are scanning. Okay, BPD, HC, ACN, FL. BPD means biparietal diameter, HC means head circumference, AC means abdominal circumference, and femur length. Okay, so whenever we are calculating this, there will be an option called caliper to measure the measurements on the console. So we just have to select, and that will pop up. That is, if you are measuring the BPD will pop up and it will store the image and the readings. It will be stored and it will be presented in this report format. So it gets easier for the doctor to read and to compare. So that was for OB scanning. Next, we move on to the musculoskeletal ultrasound. So ultrasound is also used for musculoskeletal scanning, that is for knees, to see the tendons and nerves, if there is any tear or sprain. Okay, so it is used for musculoskeletal conditions like arthritis, trapped nerves, tears, sprains. And the transducer which we use is a very high frequency, that is linear transducer, within the range of 7 to 12 megahertz. So this picture shows a tendon. Next is cardiac scanning. Here the probe which is used is of low frequency probe and which has a very small footprint, also called the phased array, which is cardiac probe. Okay, so we use the cardiac probe, and there are some dedicated machines only for cardiac studies which are available in the market, which has very advanced features also to do the various cardiac assessments. So in this, the patient will be lying in supine position with the head of the bed approximately 30 degrees upright. And in males, they have to, the chest will be completely exposed, and females can be given a gown or a towel. And then we can start the scan. Okay. So in cardiac, we take 4 views, that is subsymphoid view, parasternal long axis view, parasternal short axis, and apical 4-chamber view. So each view will be discussed now. First is the subsymphoid view. Symphoid, you know, it is the end part of the sternum. Okay. So here placement of the transducer will be at this location. So we keep the phased array probe at the inferior part of the symphoid process, such that intending the skin 1 to 2 centimeters, and the indicator of that probe should be directed to the patient's anatomical patient's right side. So we will get an image like this, wherein we will get to see the left atrium, right ventricle, and the left ventricle with some part of the liver. Okay, with this view, subsymphoid view, we will get to see all the 4 atrium and ventricles with liver. Next is the parasternal long axis view. here here we keep the probe on the anatomical left of the sternum at the fourth intercostal space, and the handle of the probe should be perpendicular to the chest wall, so that it will it indicates to the patient's right shoulder. Okay, in parasternal long axis view. So this there are two views of this, that is parasternal long axis, and the next one is the parasternal short axis. The location of the probe is same, that it will be kept on the sternum, okay, between the fourth intercostal space. So the placement, your sternum is here, so we have to place it here and then direct it. Okay, so in the long axis, it will be directed to the patient's right shoulder. So the marker should be directed to the patient's right shoulder, and the footprint of the probe is aligned with the long axis of the patient heart. So we will get to see the left atrium, the aorta, and the left ventricle. This is the same view, but we rotate the transducer to 90 degrees counterclockwise. So we get the parasternal short axis view. So it is kept on the sternum only, but we are rotating the transducer. And here we will get the papillary, we can see the papillary muscles and the mitral valve, okay, with this view, parasternal short axis view. So the appearance of the parasternal short axis view will be like a circle with the papillary muscles, with the mitral valve and the leaflets. Next is the apical four-chamber view. Do you all know the anatomy of heart?
Yes, madam.
Yeah.
Yes, madam.
Yes, madam.
Okay. How many valves are there?
4.
You name them.
Atrioventricular valve,
Mhm.
the mitral valve. Wait. Tricuspid valve,
And
Bicuspid valve.
yeah. Okay, so you have to read about the anatomy of heart, okay, so that you can understand the images of ultrasound. So try reading the anatomy of heart on ultrasound images. So in this image, in apical four chambers, we will get all the four chambers of the heart in one view. Okay, here we place the probe at the apex of the heart. You know where is the apex of the heart? In this picture, you can see it is just below the nipple. You can find the apex of the heart. So it becomes easier. Just to place your transducer on the left side of the nipple, below the nipple, and try to adjust. So you'll get the view. Okay, apical four chamber view. In females, you have to see under the left breast. Okay, below the breast. There you will get the view in females. So this picture shows all the four views in one picture. The short forms are plex, plex and PSAX, then apical four chamber and symphoid. This was the protocols to study for the ultrasound examination. That is for abdomen, musculoskeletal, then obstetric and cardiac. Okay. Remember what all used to be taken and how they are taken and what all measurements are to be done. Is it clear?
No, madam.
What happened?
I do not understand what you just said.
I'm just telling that you have to learn the protocols. That is how to do the abdominal scan. What is the patient preparation to be done? What all scans you'll be taking? Which all views? That is transverse view. You will scan the liver, the pancreas, the kidneys. Okay. Then in cardiac views, that is all the 4 views you have to take. If there is a question right about cardiac, then you have to mention all those 4 views. Understood?
Yes, madam.
Okay. And in obstetric, remember to mention the 3 trimesters with the weeks. Okay. That is 18 to 32 weeks is second trimester, and what all measurements to be taken during that time. That is BPD, then the CL, crown lump length, and femur length. Is important. Indication should be remembered. So now we'll be discussing the case studies. Okay. Then I'll show you some pictures wherein we can identify what is wrong with the patient. Once we have done the ultrasound, we can find the cause. Okay. The first case study shows that a patient who is 50 years old, female, had a complaint of abdominal pain and fever. Okay. And she was diabetic mellitus. What is diabetic mellitus? Do you all know pathologies? Or should I-
High blood sugar level.
Yes, okay. Okay. So patient has diabetes mellitus. She has abdominal pain and fever. So she has been advised to do an abdominal scan, abdominal ultrasound scan. So these are the scan studies. In the first picture, you can see there is the right kidney. Okay. It is not seen clearly, but this is the right kidney. This is the left kidney. We have to mention the right kidney and left kidney so that we do not mix up. Okay, whenever we are doing the measurements. And then this was in transverse view, wherein we get the long length and the breadth in transverse. And this is the longitudinal view of the left kidney and the only of the left kidney. Okay. This is a Doppler color flow, wherein we are using the grayscale only. And then there is something wrong with the left kidney. Okay. Here you can see some shadows. Hyperechoic structures in the left kidney. This is the bladder. Bladder is usually hypoechoic, but there is presence of debris in it. That is some gray tissue. So that tells us that there is some problem with it. Okay, and whenever we move the transducer, okay, the debris which is there will also move. So that will also tell us some information about the pathology. So the left kidney measurements, once they were taken, it shows that it was enlarged and with poor corticomedullary differentiation. Usually in the kidneys, we can see the corticals and the medulla separately. Okay. And there were some linear air shadows in the left renal lower parenchyma and in the perinephric region. There wasn't any calculus present, or there wasn't any no fluid present, that is called hydronephrosis was not there. Right kidney was totally normal without any calculus or hydronephrosis. The bladder we had shown mobile debris and there was no calculus or wall thickening. So all this finding has to be seen while doing the ultrasound scan. That is the enlargement of the kidneys or the liver or the thickening of the wall of the bladder. Okay. So the finding was the patient had emphysematous pyelonephritis. That is, it is an infection okay, with particular get formation within or around the kidneys. And it can lead to sepsis if it is not cured. Okay. So whenever the kidney size increases, there is a problem. If there is a fluid inside the kidney, that is called hydronephrosis. If there are calculus also, it can be seen on the ultrasound. So this is a second case, that is placement of IUDs, that is intrauterine devices inside the female. Here we have done the transvaginal scan. Okay. In this picture you can see E94. Okay. GYNEV. On the right hand side you can see. So GYNEV, it is the protocol which is selected. Is it clear?
Gynecology.
Yeah, gynecology. So it is the protocol which is selected. So protocol will be shown as that name will show. Then below that, that is the transducer which is selected. So E means endocavity transducer with the frequency is also shown 924. Okay. Then DR is the dynamic range which is selected. That is how much gray, bright. So it is 65. Then gain, enhancement, and MI is the mechanical index that will tell us about the bioeffects of ultrasound. I will explain that later. Okay, so this is the image of the uterus. This whole thing is the uterus. Okay, inside the uterus they have placed the IUDs. Okay. So there is a hyperechoic structure inside, that is the IUD. To confirm that placement, whether it is correct or wrong, they do the ultrasound. So transabdominal scan is done, wherein we now we are in the transverse plane and we see only a single echo. Okay, since it is hyperechoic, we are getting a shadow. This is the shadow which is seen. And since we are in the transverse plane, we are not getting the whole length of that IUD. Okay. So whenever we get in the transabdominal plane, in the transverse plane, whenever we get a single this, if we can see a single echo, that means the IUD has been placed properly. You all know the anatomy of the uterus?
Yes,
Or yet to study? What is it? Tell
now
me.
did you
Different
see?
in the uterus. The uterus is divided into different layers and different parts. We have the fundus, the body, the cervix, and we also have the
Okay.
endometrium, the myometrium, and the serous layer.
Okay. Okay. So you all know about the anatomy.
Yes, madam.
Yes, madam.
Okay. Okay. Is it getting difficult to learn this? The images are confusing, or is it okay?
It's okay.
It's okay, madam.
Okay. Remember that whenever we are doing that is the gynac scan. That is gynac means it is not to see the ovaries, and for females it is done. Okay, to see the uterus and to see the how the uterus, if there is any problem with the uterus, we do a gynac scan. And for gynac scans, we have to tell the patient to drink water. Otherwise, we won't be able to see the ovaries. Okay, next we sweep the fundus, okay, whole fundus, and that is moving the transducer towards the feet side so that we can see the fundus. Okay, as you reach the fundus, you should see the two arms of that intrauterine device. This is called Mirana IUD. If you can't see the two arms, that means that it is not placed properly. And if you see the Tesla logo, then it means that it is proper. So this is the transvaginal scan. Okay. So when we sweep from right to left, we will get to see the entire myometrium, and we look here for any fibroids or any other abnormalities if there are present. We will start from the sagittal orientation and then we'll move to the transverse. Coming to the pathologies, I have collected some of the pathologies. Here, this is the image of the bladder. Okay. How you will identify a bladder? It has a fluid
Bladder.
filled in it. Yeah,
Type
it has a
of
fluid.
the-
It's a urine filled. And it will have a nice, well, circumference area. So there is a calculus inside it. Calculus means stones, okay?
Yes,
So there is a
ma'am.
Madam, is
calculus.
that for the kidney?
Kidney, yeah. Second one is a kidney. Kidney with what?
With
It's
calculus, stones.
Stones. And what is this? The black shadow is called?
Posterior
Posterior
acoustic
shadowing.
shadowing.
What it is called?
Posterior acoustic
Posterior
shadowing.
acoustic shadowing.
Correct. Okay. So there is shadowing, so that confirms that it is a calculus. Okay. See, here also this is adnexa. Okay, in the ovaries, where you can see there are multiple cysts and lesions which are present. Above one shows the cyst. Okay, they have also a they are circular in structure and filled with fluid. There can be that fluid can be filled with debris also, some moving structures. Otherwise, it is clear. Okay, so this picture shows the cyst. There are multiple cysts, and this is a Doppler image with color. Okay. Then this is the image of the thyroid in transverse view and in longitudinal view, where there is a nodule present. Nodules can usually be felt in thyroid if they are very large, then it can be felt by palpating it. And once we do the scan, we get to know that what is there inside that nodule and how it is. Is it cancerous or not? Okay, so this is a transverse scan with the nodule, and in the longitudinal view, you can see some dots inside that nodule, puckle kind of thing. Okay, so these are called internal echoes, which are present inside the nodules. This picture shows liver masses, different multiple masses are there inside the liver. Okay. Coming to bio effects of ultrasound, that is biosafety. Why ultrasound is said to be safe, but still there are some studies going on whether it is actually safe for the pregnant ladies and the fetus. Since fetus is continuously growing, the cells are continuously multiplying. The ultrasound will have some effects. Okay, what happens is in the first class when I've told you all that when ultrasound leaves the transducer, it has undergoes 4 processes. Okay, I'll finish this part. These are the references which I have mentioned for a few slides. Okay, so I was telling about bioeffects. So what happens is whenever an ultrasound beam enters the body, it can either get refracted, or it can be scattered, or it can be absorbed. So whenever the ultrasound beam gets absorbed, this mechanical sound energy will be converted into heat. Okay. So what will happen if if every time we scan, continuously we scan, it will continuously get absorbed. Okay. Once it is absorbed, it will heat that area, and that can cause problems to the patient. If we are scanning an adult patient, it won't create much issue. But if we are scanning a pediatric, a small neonate, what will happen is it can cause burns due to continuous heating. So the scan time should be reduced. The scanning continuously at single point should be reduced, and there should be gaps created while scanning. And also the parameters which are set. If we are using a very high frequency transducer, so that means that we are sending lot of ultrasound waves to the patient, and that can cause more absorption of heat and more heating. So with high frequency probe, the chances of this heating are more. Also, with different techniques, that is Doppler techniques, pulsed, then spectral. Okay, in pulsed wave Doppler, whenever we are using pulse wave Doppler, the mechanical index or the thermal index, that is the heating index, is higher, and that causes heating. So it is regulated that we should not use pulse wave Doppler for measuring the heartbeat of the baby, okay, fetus. We use the M mode to measure the heart rate. That is the reason we don't use a pulse mode, because of the bio effects of the ultrasound, which can cause harm to the fetus which is there. There are two measurements which are mentioned for measuring the effects, that is the thermal index and mechanical index. Thermal index will tell us how much heating it is there, and mechanical index is how much ultrasound beams are passed. Okay, so some settings are there in the ultrasound machine wherein you can use it to reduce the power. Okay, if we keep the power 100, more ultrasound wave will be sent. If we are scanning the pediatric, then we can reduce it to 50 or 80. Is it clear?
Yes, madam.
Madam is clear.
Do you all have any doubts now? Your cameras. I'll ask you some questions.
I have a question
Yes.
about trimesters.
Hmm.
The first trimester,
Yes.
to that presentation, the first trimester is from conception to 13 weeks plus 6 days. And the second trimester is from 18 to 26 to 22 weeks.
Huh.
Then third trimester from 32 to 36 weeks.
Yes.
Okay, my question is, now, how do we name the period between maybe 14 weeks to 18 weeks? Then the period between 22 weeks to 32 weeks, how do we name those periods? Because they don't fall either first, second, or third.
Yeah, this is because see, these weeks are set because during this time only we will get the images. Okay, rest all if you go and do the scan, it is simply waste, because we won't get that information, because that growth won't happen during that period. We just don't name it. We just say that it is second trimester. During that time period, we have to do the scanning.
Scan, okay. I get it.
Understood?
The time
It
that
is not
we
like
are supposed to
they have
say,
said that
scan.
weeks because of the images they get. If we are scanning 32 weeks, we won't get good images, but it is best preferred that you are do the scan between 18 to 22 weeks. For further clarification, they will go for that 30 to 36 weeks. When the delivery date is nearby, they will, if they have an anomaly or if they have issue, they will do the scan. You must have observed sometimes, or if the doctors won't call them frequently, they will give specific dates. So because they calculate those dates, that gestational age, and then they tell the patient to come. Any other doubts?
Madam, please, I have a question. Madam,
Tell me. Tell me.
you talked about the thermal, the heating that's caused by
Yeah.
high frequency
Huh.
transducers and early trimester of pregnancy, the thermal index. What I want to know is when we use high frequency transducer, maybe let's say we do an endovaginal scan, it it can produce overheating, but how does that overheating affect the embryo at that moment? Does it has a specific um, effect on the embryo?
Yeah. Actually, the studies are going on for that only. That actually it is affecting, but they are on a safer side. They have just told that you should not cross. So there will be some indications. I told you, that MI and TI is there, thermal index and the mechanical index. So you have to see those values and then confirm. Okay, if the value exceeds the set values which are there, then you have to reduce your timing of scanning. Okay, so the console or the ultrasound machine will indicate you if the values go above. What the effects are there, what effects it causes, the studies are still going on. So if you want to know, you can read more about it. We'll discuss it in the next class. Okay, if anyone gets about information about it, we'll discuss. Is your
Well,
questions
madam, the machine.
is pending?
Hello, madam. Up on the machine is used to control the mechanical index.
Can you repeat?
We know which knob on the machine is used to control the mechanical index. Can a sonographer control the mechanical index by turning a knob?
Yeah, I told you about power, right? There is something called power on that touch screen. It is available. Okay, just have to select on that and then it will change. It is not like X-rays and CTs wherein we reduce the kVp and we will get the radiation will reduce. Here there are other settings which will ultimately reduce the mechanical index or the thermal index.
Thank you.
Tell me.
Madam, please, can you still just
But I
give
thought that
a
they're like
small
protocol.
review on that bar?
One at a time.
Biological effect.
Come on, tell me.
Yes, madam, can you just please, I missed some few things in bio effect. That was because of my network. I don't know if you can take a short review again. That's if it's possible.
You missed what?
Bio effects of
I missed bio effects, lectures on bio effect due to my network connection. I don't know if you can take a short review again about bio effects.
Yeah, bioeffects.
During
So there are two bioeffects which are there. The one is mechanical bioeffect and one is the thermal bioeffects. Okay. So yeah, mechanical, it is the damage caused by the oscillation of the sound waves on the tissue. Okay. So what happens is, and thermal one is due to the heating of the tissue. So in mechanical, the sound waves, they are vibrating. As I've already told, they are vibrating continuously vibrate. So there are small bubbles which are there, and they have the tendency to burst those bubbles because of this vibration. Continuous vibration they will get and they will burst. So that will produce a pressure, that will cause effects in the body. Okay, that is called mechanical. And heat, that is thermal index, is just heating of the tissue. So that is usually seen in the neonates. We are more worried about neonates and pediatrics. Adults can, that is, they don't have that much of problem with.
Okay, madam. Thank you very much.
I will share the activities in the group, okay? Questions. And some of you all didn't submit your assignments. What is the reason?
Yes,
Power
madam. The
failure.
reason is that apart from even power failure, it's just that there's the assignments that they give. Other lecturers give heavy assignments, so there is little time to finish and submit. So that's my main problem. I don't have a problem of power failure for now, but the other courses are giving too many assignment and it's not small. One has to take at least 8 hours to do that assignment because it's not something that you have to copy and paste. You have to read, summarize, or typing it down. Commission.
You have other questions, right? Had the questions,
Yes,
right?
madam.
Okay,
Yes,
then you
madam.
could down on your on a paper and then you just scan it and submit it.
Sorry.
You can write it down and get the information.
Okay, madam.
You
I'll
all are
write it
given
down.
books to refer.
No, I've not been given any books here.
Okay, I'll give some names of the books. Just get those books. If you all can get it from the library, then it's good. Just download it and take notes from them. Okay, because learning
Okay,
from the books,
madam. That
then the PPTs and all those.
okay, madam. That was very helpful. Thank you.
Yes. Any other question?
Ay, I'm tired.
Can the number, can the where the assignments are given, can they be coordinated when every instructor is like giving assignment at the same time? The assignments are very bulky and we have a lot of issues like internet connection, power failure, and all those things. To do those assignments, they are difficult. So if the way the assignments are given, they can be coordinated, it will be better.
Madam,
What do? Assignments are important.
I wanted to also say that since they should give the space to submit assignment, they should try to lengthen it, increase it, because we'll have one lecture will give 3 assignment. You have to submit before you're not even finished with that one. Another person has given assignment. At the end of the day, you cannot even read. It's just assignment, and you have to come for classes. It's really tiring. To couple it with work, it's not really been easy. So for me, I feel if the deadline to submit assignment could be a bit like should have a little bit time, because many other lecturers are giving very lengthy assignment that you just look at it, you're tired. So that's my own issue. That's my own problem.
But assignments, by doing assignments, you all will learn, right? You all don't do assignments and
Yes,
read about
Yes,
how
madam,
we
you will learn, but you might
yes,
not be able to
madam. We'll
catch up
learn
with
one concerning.
everybody's
right?
assignment.
Yes, madam. Assignments are very important. We are not refusing that they should not give us assignments for that fact. We are very much happy to do assignment because it helps us to do a lot of research. What we are pleading is that we can lengthen the deadlines for submission of assignments. Like for example, if they ask us to do an activity, we are pleading that they can give us at least
A week.
Yeah, you'll have a week. Like if today's class is Tuesday, then you have to submit it on the next Tuesday class. It is not like last time class was late because of the network issue. Right?
yeah.
And then that's good. That's better. If you have 1 week, that's better.
And I had given only 2 questions, not more. Just differences. That was easier.
No,
Yes.
yes, madam,
What?
but we're not talking about only you. We're talking about all the lecturers in general. You gave 2. The other lecturer gave 3. The other one, I don't even know anymore. So, so
The other
that's
one
just
Just
gave
study.
it.
more.
Can't do anything about it. You have to study.
All right, madam. In your
Okay.
own time, we're pleading that at least if you give an activity, you give us at least maybe 48 hours for submissions.
Just one.
I don't know if it's
Just 1
possible.
week now.
They say 1 week, you say 48
1 week.
hours.
1 week.
Ah,
If you don't get it, then that would be nice, madam.
Hey.
You'll want?
Thank you so much, madam. I did not get that clear because of
Nah.
I'll be posting the assignments. Okay, this time it is little bit more than
my
the last. Okay, and I that you all will submit it on time. And this assignment I want it submitted by the end of the day. Is it okay? It's a little bit. It's a very
at the
complex
end of
assignment what I gave you last time.
But I want to submit it by when?
By Tuesday, right? Today. You have to submit it
Okay,
today.
madam.
Otherwise, your mark.
Madam,
Yes.
please, another issue is where the assignments are given. If they can be sent to the WhatsApp group for each course, then it will be better rather than putting it in the workplace.
Okay.
Yeah.
You spoke this with sir. You told him about this. About
No,
this issue.
madam.
And there shouldn't be any plagiarism between your assignments. Okay, no copying. You all know, right?
Yes, madam.
yes.
No copying from when, madam?
Copying from one another. Like I have done your assignment, then I'll copy from yours like that.
No,
No
nah.
copy.
If the assignments
Further.
can be sent to the WhatsApp group, it will be better because you see this one, you mix with this one. You don't even know when this one is given and at what time this one has been given. They are just mixed
Okay.
up.
Okay.
No, they're not
I'll
mixed
confirm
up.
that with sir.
They're in
Okay, I'll ask.
different groups.
In the workplace.
Yes, in the
Yeah, in the
workplace, they're in
WhatsApp, you
different
don't want
groups.
it. You'll want it in this, no? WhatsApp.
It's preferable.
Oh, yo, my head. Tired.
Okay, I'll speak to sir and I'll let you know about the assignments where to be posted. Okay.
Okay,
Any
madam.
other doubts on this topic?
okay.
Please read about it on ultrasound. What are the protocols and how to do it? Try looking for images so that you understand a little bit. And if any doubts you have, then please let me know. Okay. Thank you, students. Thank you, students.
Okay. Bye-bye,
so
madam.
Thank you, madam. Bye bye.
Bye.